Hello, my name is Jennifer Dochod, and I am an occupational therapist from Grand Rapids, Michigan. I am also a person with POTS, Ehlers-Danlos, hypermobility type, mast cell activation, and chronic migraines, among other complex medical conditions. Currently, I am not treating patients due to an exacerbation in my health conditions, but my specialties include chronic health conditions, mental health, and geriatrics. It has been rewarding to help individuals with chronic health conditions increase functioning and participation in desired activities. I have written 2 articles on POTS and occupational therapy in peer-reviewed healthcare journals, and I am honored to serve as a board member for Awareness for POTSIes. Today, I will be presenting on navigating heat with POTS. First, let's talk about what occupational therapy is. Occupational therapy is an interactive therapy that promotes healthy behaviors, independence, participation, and well-being for individuals coping with various health conditions. Occupational therapists, or OTs, evaluate and treat related to activities of daily living, such as self-care, home care, school and/or work, family life, and leisure. OTs are holistic. They treat the whole person, mind, body, and spirit. This allows them to address contextual needs such as environment, desires, goals, values, and cultural needs. They tailor interventions to help individuals learn to plan, pace, prioritize, and conserve energy. Part of occupational therapy can include assisting an individual with adaptations to activities and/or environments to increase their ability to effectively participate. OTs can assess for and recommend adaptive equipment. Outcomes of occupational therapy can include increased functioning, expanded participation in purposeful and meaningful and desired activities, as well as increased performance and enjoyment. All of these can enhance health-related quality of life and well-being. So, why can occupational therapy be helpful for an individual with POTS? Often, there is a delay in diagnosis and treatment of POTS. It may lead to decreased functioning. Decreased functioning can result in reduced participation in purposeful, meaningful, and desired activities. Activities that used to be easy may have become very difficult. The varying intensity of symptoms can be difficult to manage. It is easy to become overwhelmed in these situations. Being holistic practitioners, OTs are expertly skilled in addressing the unique needs of individuals with POTS. Additionally, incorporating some of the skills learned in occupational therapy can better prepare individuals with POTS to participate in other therapies such as physical therapy, mindfulness-based training, cognitive-based therapy, and adaptive yoga, among others. OTs can also recommend adaptive equipment, ways to adapt differing environments, and address accommodations for school and/or work. Navigating heat with POTS. The body's difficulty with regulating temperature or thermal dysregulation, is often experienced with POTS. For individuals with autonomic dysfunction, such as POTS, heat sensitivity can be a significant trigger for flare-ups. In a POTS community poll, heat was identified as one of the most common causes for worsening of symptoms. There is also a functional impact. Heat can limit our ability to participate in outdoor activities and even some indoor ones. Hopefully, after this presentation, you will learn ways to better manage heat, which may allow you to participate in some desired activities in more adaptable ways. It's complicated, as is just about everything is with POTS. Heat's impact on our lives with POTS is complex. It's more than just a physical process. Let's look at the biopsychosocial impact of heat. Psychologically, it can trigger feelings of grief due to the loss of engagement in previously enjoyed activities. Frustratingly, others may not understand the effects of heat on our bodies and even question the overall burden of POTS. Family, friends, teachers, and/or employers may perceive it as a way to get out of responsibilities or simply because the person with POTS wants to get out of doing something. Others may see it as an attention seeking and question secondary gains. The reality is that the individual with POTS can be stigmatized, which further increases the psychological burden of POTS and decreases quality of life. There can be a social aspect as well. Friends, family, classmates, and/or coworkers may limit the inclusion of individuals with POTS in activities instead of looking for activities that are more suitable or adaptable to do together. Family and friends can become distant because they don't understand or know what to do or say. These types of responses are hurtful and can leave a person feeling rejected, lonely, and isolated. Feeling rejected, lonely, and isolated has a negative impact on quality of life and increases the overall burden of POTS. The third impact of the triad is biological and physiological. The autonomic nervous system helps control your body temperature by regulating blood circulation, constricting or dilating blood vessels, and sweating or shivering in response to heat or cold. The body radiates heat and generates sweat to try to cool itself. When sweat evaporates, it pulls more heat from the body, cooling the skin and tissue below. Unfortunately, this doesn't always work properly in a person with autonomic dysfunction, such as POTS, and symptoms can quickly worsen. Other medical conditions with heat intolerance include mast cell activation, autoimmune disease, endocrine disorders, other dysautonomias, multiple sclerosis, and many other health conditions. In a person with autonomic dysfunction or dysautonomia, such as POTS, heat can quickly worsen symptoms. When blood vessels dilate in response to heat, blood pooling in the lower extremities increases, and in response, the heart rate increases to redistribute the blood. Brain fog can be exacerbated by not enough oxygen-rich blood getting to the brain, and blood pressure variations can also be experienced. In addition, profuse sweating contributes to quicker dehydration. Responses to heat may be experienced differently amongst individuals with POTS. One person with POTS may have severe symptoms in response to heat, while another person with POTS may only experience mild symptoms. POTS symptoms happen on a spectrum, and what is experienced is individualized. Responses and varied intensity can also be different within the same person, depending on other burdens such as stress, pain, and menstruation. Some days may be better than others and cause less symptoms in response to heat, while at other times the symptoms can be severe. Additionally, once in a cooler environment, some may experience an overshoot, where their bodies work so hard at cooling that they overcool and cause shivering. Planning ahead for heat can help us better navigate experiences. There are many things that we can learn to do to help cope with heat. There are many things we can do related to energy conservation. When it's hot, it is important to conserve energy. Your body is already working harder to cool itself. The hottest part of the day is not the time to participate in energy-consuming activities. Choose cooler parts of the day, such as mornings or evenings, to do activities that require more energy. Postponing high-energy activities to a cooler day in the week may also be needed. You may also need to use adaptive mobility devices such as a rollator, which is a walker with a seat, or a wheelchair to conserve energy when it is really hot. Pacing is another strategy to help navigate heat as your body is already working harder to manage symptoms. Plan ahead to alternate higher activities with lower ones to give yourself some breaks in between. Look at the weather forecast to help you plan for the week. Spread out activities throughout the day and week and allow for more rest breaks. Remember that it's okay to ask others for help and to be kind to yourself. Hydration. We know that this is so very important for people with POTS and cannot be emphasized enough, because dehydration further contributes to heat intolerance, heat cramps, heat exhaustion, and heat stroke. These are serious emergencies that need prompt attention. Fluids and electrolytes, especially salt, are lost through sweating, creating an even greater need to hydrate and balance electrolytes when it's hot. Consult your doctor on electrolytes needed and their recommendations for you. Be aware of the sugar content of sports drinks when choosing what's best for you. Drink several glasses before going out. Bring several bottles of water, some with electrolytes, with you to stay hydrated in the heat and keep rehydrating. Let's talk about clothing considerations. What you wear can have a big impact. Choosing what works best for you is what matters. Some find that lightweight, loose cotton clothes that allow air to circulate are cooler. Woven cottons are lighter than knit cottons. Woven cottons and linens are the lightest and allow air to circulate more fully, as opposed to knit cottons. Knit cottons are still better for air circulation than man-made fibers such as rayons, polyester, nylon, and spandex, as these tend to hold in the heat. However, if you have a tendency to profusely sweat, cottons take longer to dry than man-made fabrics. This may leave you feeling cold and clammy as you stop sweating or move to a cooler environment. Others find that man-made fabrics designated as moisture wicking, those that help pull moisture away from the skin into the surface of the clothing to allow it to evaporate quicker, allow you to stay dry, are more helpful. However, the effectiveness of these garments in humid environments lessens, and the chemicals in the fabrics can also be harmful and irritating to the skin. Light-colored fabrics don't soak up the heat from the sun like darker-colored fabrics and are therefore cooler. Remember to dress in layers so you can put on and take off clothes as needed. Let's look at some clothing accessories. There are many options here as well. If compression stockings are recommended by your doctor, the sheer ones may be cooler in warmer conditions. Other clothing accessories could include wide-brimmed hats, baseball caps, and visors to help keep the sun off your face. There are also cooling vests, which can be helpful in the heat, as well as other wearable cooling accessories such as iced gel neck, head, and wrist wraps. And don't forget sunglasses to protect from UV rays. Things to consider when planning for outdoor activities. While outdoor activities in the heat can be challenging, planning ahead with the tips talked about previously in this presentation can make them more successful. It is important to create a backup plan or exit strategy in case you are unable to tolerate the heat and need to leave quickly. This may include a way to leave an outdoor concert venue, scoping out cooler nearby environments, and/or planning for transportation out of the event. It's helpful to plan outdoor activities for the cooler parts of the day, such as the early morning or evening. Try to avoid peak sun. Stay in the shade or use a sun umbrella. If possible, park the car in the shade. Use a car windshield shade. Put down windows an inch or so to prevent heat buildup in the parked car. Place light-colored beach towels over the seat to prevent them from getting too hot. And consider bringing a wheeled cooler with extra water, drinks, and ice or / gel packs. Preparing a POTS bag for heat. Having things on hand and ready to go makes going out easier. There are so many products to consider, and there are great links to helpful products on the Awareness for Potsy's website. Products to consider include snap ice bags that get cold when the contents are snapped and then shook, ice gel packs, ice necklaces, water bottles, and electrolyte packets. There are also snap cool athletic towels that, when wetted, wrung out, and snap, activate a cooling mechanism that is great to put around your neck. A spray bottle with water can be useful along with an array of fans, some as simple as an accordion fold handheld fan to battery operated small fans and ones that go around your neck. There are also fan mister combos. Another item to consider is a handheld towel or handkerchief to wipe away sweat. And don't forget the sunscreen and salty snacks. With the amount of items that may be needed, a rolling bag may be helpful. Not that all of these things are needed, it just gives you a list to try from. What is important is finding what works best for you without being too much to manage. There are also home adaptations for heat. Use air conditioners or window units if accessible. Close windows and window coverings during the day to prevent heat buildup. Open window and window coverings at night to let cooler air in can aid in reducing cooling costs. Running fans can also help keep things cooler inside, even with air conditioner. Using window fans during the cooler nights can help if you don't have access to air conditioning. Minimize the use of heat-generating appliances such as the stove or dryer during the hottest parts of the day. Instead, use a microwave, slow cooker, Instapot, or foodie, and/or prepare foods in the cooler mornings or evenings. Other heat relieving options. Having heat intolerances doesn't mean that you have to stay indoors all the time that it is hot. If you have access to a swimming pool, depending on the air and water temperature, it may be helpful to submerge in slightly cooler water. Even using a kiddie blow-up pool can help make heat tolerable enough to be outside for a while. Sometimes being in a wet swimsuit when the temperatures are really high allows you to be outside. Try to stay in shaded areas to help reduce temperature and sunburn risk. Spraying yourself with a spray bottle instead of a garden hose may also be helpful in controlling the temperature of the water. Remember that sometimes people with thermal dysregulation and dysautonomia can experience an overshoot, going from really hot and sweating to really cold and shivering. A garden hose mister attachment may also be an option to explore because you are not hit with a lot of cold water at once. Other possibilities include looking for air-conditioned environments, such as libraries, malls, restaurants, and movie theaters. Remember to dress in layers. Dealing with heat related to bathing. Bathing can be particularly challenging and a draining task for individuals with POTS. Hydrate while you are getting ready to bathe. Have a water bottle within reach of where you are bathing and rehydrate after bathing. Hot water in a hot environment further widen or dilate blood vessels. This leads to more blood pooling in the lower extremities, which triggers the heart to beat more rapidly to redistribute the blood. The rapid heart beating can also cause rapid breathing and lightheadedness. To lessen this, keep water temperatures only slightly warm and turn the water off intermittently to decrease heat and steam buildup. Use an exhaust fan if your bathroom is equipped with one, or leave your bathroom door open to increase ventilation. A safely placed fan away from the shower or tub can also help with air circulation. There are other safety precautions to consider, such as adaptive equipment, bathing during a time of less symptoms, and if available, having a person on standby or a phone nearby in case help is needed. Consider using bathing adaptive equipment. Because of heat's effect on the body of individuals with POTS, such as vasodilation and increased blood pooling in lower extremities, contributing to dizziness, lightheadedness, presyncope, tachycardia, and shortness of breath, safety is an issue. There are several items that can make bathing safer and easier. Strategically placed grab bars can be helpful to safely enter and exit the tub or shower. Non-slip bath mats placed inside the tub or shower and on the outside can also help reduce slipping. A shower seat, tub bench, or tub transfer bench allows you to sit while bathing, can help reduce blood pooling, conserve energy, and reduce falls. POTS is enough to manage. You don't need other injuries on top of it. A handheld shower hose makes it easier to position the stream of water when using a shower chair or tub bench. Shower hose holders that use a suction cup to attach to the side of your shower allow you to brace your shower head in a closer position while you use two hands to wash your hair or shave. Keeping needed supplies in a plastic basket with a handle allows you to grab all items needed and place them within easy reach. This also helps conserve energy. Another energy conservation tip can be using a terry cloth robe to wrap yourself in instead of drying off with a bath towel. You may also find a microfiber head wrap helpful for drying your hair. Experimenting with bathing at different times of the day may help you determine what works best for you. Some individuals with POTS may find that bathing is particularly draining. Therefore, it works better to do it in the evening when they can go to bed afterwards. Thank you for joining me for this presentation on navigating heat with POTS. Hopefully you have learned some helpful things to try when navigating heat that can help reduce symptoms and increase participation in desired activities. Check out the awarenessforpotsies.org website for additional tips and tricks and a section on helpful items that has links to many of the products that we talked about today.